Have you ever noticed how your heart pounds when you're anxious or stressed? That sudden rush, the quickened breaths, the feeling of unease, these are not just fleeting emotions, they are physiological reactions deeply intertwined with your cardiovascular health. While we often think of anxiety as a mental challenge, its effects extend far beyond the mind, shaping the very rhythm of our heartbeat and the health of our arteries. In today's fast-paced world, chronic stress and anxiety have become common companions. But what many don't realize is that these invisible burdens can silently put immense pressure on the heart. Scientific research has now revealed a profound connection between anxiety and cardiovascular disease, showing that unmanaged stress can lead to hypertension, heart arrhythmias, and even long-term heart damage. But here's the good news: understanding this connection gives us the power to take control. By exploring how anxiety impacts the heart and learning practical strategies to counteract its effects, we can take proactive steps toward a healthier, calmer, and longer life. So, let's dive in and uncover the crucial relationship between your mind and your heart, because protecting your mental well-being might just save your heart. The profound connection between anxiety and cardiovascular health. How anxiety affects heart rate and blood pressure. Anxiety is not merely an emotional response, it has a significant physiological impact on the cardiovascular system. According to the American Heart Association, AHA, chronic stress and anxiety can lead to prolonged activation of the sympathetic nervous system, SNS, causing an excessive release of stress hormones such as adrenaline and cortisol. This heightened state triggers the cascade of cardiovascular responses, including increased heart rate, tachycardia. The heart beats faster to prepare the body for perceived threats. Elevated blood pressure, hypertension. Blood vessels constrict, increasing resistance and raising blood pressure. Increased cardiac output. The heart works harder, pumping more blood through the body. Higher oxygen demand by the heart. Increased strain can lead to chest discomfort and shortness of breath. Prolonged activation of these responses can contribute to hypertension, arrhythmias, and even long-term structural heart changes, increasing the risk of heart disease and stroke. Research from the Harvard Medical School indicates that individuals with chronic anxiety have a 48% higher risk of developing hypertension compared to those without anxiety. Anxiety-induced hypertension, the silent threat. Persistent anxiety can lead to chronic elevation in blood pressure, which, if left unmanaged, may cause serious complications such as atherosclerosis, heart failure, and kidney damage. Studies published in the Journal of the American College of Cardiology suggest that individuals with anxiety disorders are more prone to developing essential hypertension due to 1. Vasoconstriction. Stress hormones constrict blood vessels, leading to increased vascular resistance. 2. Increased cardiac workload. The heart has to pump harder against this resistance, leading to left ventricular hypertrophy. 3. Autonomic dysregulation. Anxiety disrupts the balance between the sympathetic and parasympathetic nervous systems, leading to prolonged cardiovascular strain. A 10-year longitudinal study by the European Society of Cardiology found that patients with high anxiety levels were at a 40% greater risk of developing coronary artery disease, CAD, than those with lower stress levels. These findings highlight the critical role of stress management in preventing long-term cardiovascular damage. Anxiety and cardiac arrhythmias, breaking the cycle. Anxiety can significantly disrupt normal heart rhythms, leading to conditions such as sinus tachycardia. The heart rate exceeds 100 beats per minute at rest. Premature ventricular contractions, PVCs, extra or skipped heartbeats cause a fluttering sensation. Atrial fibrillation, AFib, an irregular, often rapid heart rhythm that increases stroke risk. A study in the Journal of Psychosomatic Research revealed that patients with anxiety disorders were more likely to experience arrhythmias due to heightened awareness of their heartbeats. This heightened awareness can create a self-perpetuating loop, where anxiety causes palpitations, and palpitations further exacerbate anxiety. The vagus nerve and heart rate regulation. The vagus nerve is crucial for balancing heart rate by activating the parasympathetic nervous system, PNs. When the vagus nerve is engaged, it slows heart rate and promotes relaxation. Effective ways to stimulate the vagus nerve include: deep diaphragmatic breathing engages the PNs, slowing heart rate. Meditation and mindfulness, proven to enhance vagal tone and heart rate variability. Cold exposure, e.g., cold water face immersion, activates the vagus nerve and reduces SNS dominance. Lifestyle interventions for cardiovascular health. Given the impact of anxiety on heart health, it is essential to incorporate lifestyle changes that mitigate stress and support cardiovascular well-being. 1. Stress management techniques. Cognitive behavioral therapy, CBT studies from the National Institute of Mental Health, NIMH, show that CBT can effectively reduce anxiety-driven cardiovascular issues. Breathing exercises, 4-7-8 method helps reduce blood pressure and stabilize heart rate. Progressive muscle relaxation, PMR, reduces muscle tension and lowers stress-related blood pressure spikes. 2. Physical activity and cardiovascular resilience. Moderate aerobic exercise, e.g., brisk walking, cycling, enhances heart efficiency and lowers resting heart rate. Strength training improves vascular flexibility and reduces hypertension risk. Yoga and Tai Chi lowers cortisol levels and enhances autonomic regulation. A study from the Mayo Clinic found that individuals who engaged in regular physical activity had a 30% lower risk of developing hypertension compared to sedentary individuals. 3. Nutrition for a healthy heart. Omega-3 fatty acids, found in fish, flax seeds, reduce inflammation and stabilize heart rhythms. Magnesium-rich foods, e.g., leafy greens, nuts, help regulate blood pressure and prevent arrhythmias. Polyphenol-rich foods, e.g., berries, dark chocolate, improve endothelial function and lower stress-related hypertension. 4. Sleep and recovery. Prioritize 7 to 9 hours of quality sleep. Poor sleep increases stress hormones and heart rate variability. Avoid late-night stimulants. Caffeine and alcohol can elevate nighttime blood pressure. Create a relaxing bedtime routine. Reading or meditation before bed supports cardiovascular recovery. Medical approaches to anxiety-induced cardiovascular symptoms. For individuals experiencing severe anxiety-related cardiac symptoms, medical intervention may be necessary. Beta blockers, e.g., propranolol, metoprolol, reduce heart rate and palpitations caused by anxiety. Selective serotonin reuptake inhibitors, SSRIs, address underlying anxiety that contributes to cardiovascular symptoms. Benzodiazepines, used with caution, provide temporary relief for severe anxiety but are not a long-term solution. Holistic therapies, acupuncture and biofeedback have shown promise in reducing stress-related hypertension. The call to action: protecting your heart today. The scientific evidence is clear: chronic anxiety is a major risk factor for cardiovascular disease. Recognizing the connection between mental and heart health is the first step in protecting yourself from preventable complications. Implementing stress management strategies, engaging in regular physical activity, and maintaining a heart-healthy diet are crucial for long-term cardiovascular resilience. Leading cardiologists from the Cleveland Clinic emphasize that a heart-healthy lifestyle begins with stress reduction. By prioritizing mental well-being, you are not only easing anxiety but also actively protecting your most vital organ, your heart. As we've explored, anxiety is more than just an emotional experience. It's a force that can shape your heart's health in ways you may never have imagined. From increasing blood pressure to triggering irregular heart rhythms, the effects of stress on the cardiovascular system are real and significant. But here's the most important takeaway: you have the power to break the cycle. By prioritizing stress management, engaging in regular physical activity, nourishing your body with heart-healthy foods, and practicing mindfulness, you are not just calming your mind, you are actively protecting your heart from harm. Small, intentional changes in your daily routine can lead to profound improvements in both your mental and physical health. So, let this be your reminder: your heart deserves care, not just in the physical sense, but in the emotional and mental sense as well. Choose peace over worry, mindfulness over stress, and a heart-healthy lifestyle over neglect. And if this message has resonated with you, don't keep it to yourself, share it with your loved ones. Because in spreading awareness, you're not just saving your own heart, but helping others protect theirs as well.